Advanced Musculoskeletal System Block for 7th semester in Medical Faculty. The Advanced Musculoskeletal System Block provides an in-depth understanding of the anatomy, physiology, biomechanics, and pathology related to the musculoskeletal system. This block focuses on musculoskeletal diseases and disorders, including degenerative, traumatic, infectious, and inflammatory aspects, as well as diagnostic and therapeutic approaches. 1. Anatomy and physiology of the musculoskeletal system. Anatomy of the musculoskeletal system. Bones. Types: long, short, flat, and irregular bones. Main components: cortical, compact, and trabecular, spongy. Functions: protecting organs, calcium storage, and blood cell production, hematopoiesis. Joints. Types: synovial, e.g., knee, shoulder, free movement. Cartilaginous, e.g., spine, limited movement. Fibrous, e.g., cranial sutures, no movement. Components: cartilage, synovial membrane, synovial fluid, and ligaments. Muscles. Types: skeletal, voluntary, related to bone movement. Cardiac, involuntary, pumps blood. Smooth, involuntary, controls internal organs. Mechanism of contraction involves actin, myosin, ATP, and calcium ions. Ligaments and tendons. Ligaments connect bones to bones. Tendons connect muscles to bones. Nervous and vascular systems. Innervation of muscles and joints by somatic and autonomic nerves. Blood supply is essential for bone and soft tissue injury healing. B. Physiology of the musculoskeletal system. Bone functions. Mineral storage, calcium, phosphate. Hematopoiesis in red bone marrow. Bone remodeling by osteoclasts, resorption, and osteoblasts formation. Muscle contraction. Triggered by nerve impulses releasing calcium from the sarcoplasmic reticulum. Actin and myosin filaments slide to produce contraction. Injury healing. 3 main phases: inflammation, proliferation, and tissue remodeling. 2. Pathology of the musculoskeletal system. A bone disorders, osteoporosis, decreased bone mass due to imbalanced remodeling. Risk factors: age, menopause, calcium, vitamin D deficiency. Symptoms: pathological fractures, especially in the spine and hip. Fractures. Types: open, closed, transverse, comminuted. Healing involves bone callus, osteoblast activity, and remodeling. Osteomalacia, rickets, cause, vitamin D deficiency. Symptoms: soft bones and deformities, rickets in children. Bone tumors. Benign, osteochondroma, or malignant, osteosarcoma, Ewing's sarcoma. B. Joint disorders, osteoarthritis, degeneration of joint cartilage. Symptoms: joint pain, stiffness, deformity. Rheumatoid arthritis, autoimmune disease attacking synovium. Symptoms: pain, swelling, and morning stiffness. Gout, uric acid crystal accumulation in joints. Symptoms: acute joint pain, commonly in the big toe. Septic arthritis. Cause: bacterial infection, e.g., Staphylococcus aureus. C. Muscle disorders. Muscular dystrophy. Cause: genetic mutations, e.g., Duchenne muscular dystrophy. Symptoms: progressive skeletal muscle weakness. Myositis, muscle inflammation due to infection or autoimmune disease. Cramps and spasms. Involuntary muscle contractions caused by dehydration, electrolyte imbalance, or fatigue. D. Trauma and injuries. Sprains and strains. Sprain, ligament injury. Strain, muscle or tendon injury. Overuse injuries. Examples: tendonitis, bursitis, shin splints. 3. Diagnosis of musculoskeletal diseases. A history taking and physical examination. History taking. Main complaints: pain, swelling. Stiffness or deformities. History of injury or occupation-related risks. Physical examination. Inspection. Deformities, swelling, or muscle atrophy. Palpation. Tenderness, crepitus in joints. Functional tests. Active, passive range of motion, muscle strength. B. Supporting examinations, imaging, X-ray, detect fractures, bone deformities. MRI. Evaluate soft tissues, ligaments, tendons. Muscles. CT scan. Complex bone lesions or comminuted fractures. Laboratory tests. Inflammatory markers, ESR, CRP, for arthritis. Uric acid levels for gout. Calcium and vitamin D levels for osteoporosis. Bone, muscle biopsy, for diagnosing tumors or muscular dystrophy. 4. Management of musculoskeletal diseases, a pharmacological therapy, analgesics. NSAIDs, ibuprofen, meloxicam, for inflammatory pain. Paracetamol for mild pain. Anti-inflammatory drugs, steroids for rheumatoid arthritis. Anti-resorptive drugs, bisphosphonates for osteoporosis. Supplements, calcium and vitamin DB non-pharmacological therapy, rehabilitation and physiotherapy, muscle strengthening, stretching, and joint stabilization exercises. Patient education, ergonomic techniques, injury prevention, and osteoporosis management. C. Surgical interventions, arthroplasty, joint replacement, knee or hip. Osteotomy, correction of bone deformities. Fracture fixation, use of plates, screws, or intramedullary nails. 5. Clinical training in the Advanced Musculoskeletal System Block, physical examination practice. Palpation techniques and evaluation of joint range of motion. Clinical case simulations. Management of patients with osteoporosis, fractures, or arthritis. Imaging interpretation. Reading X-ray, MRI, or CT scan results for musculoskeletal cases.